We're back. Welcome back, everyone. Okay, when we do our Q&A, it would be great if we could have all of our panelists have their video feed on, okay? For now, though, we've got a couple of things coming up that you don't need to unless you want to. Okay, we do appreciate all the answers to the questions. This is really great. Now that we're all back and situated, we're going to hear from our very own Georgia Peach or Vidalia Onion, depending on your mood, our executive director, Paula Schmitt. Paula, are you there?
Yes, ma'am, I am. Thank you, Muriel. Hi, everybody. I'm very glad that you could join us today, and I hope you're learning a lot of new things today like I have. I especially enjoyed learning about the differences in the types of dialysis. But today I'm going to bring you an update on some of the financial assistance programs that may be available to you as amyloidosis patients. So if Bob can pull up the video. Here we go. And you'll be able to listen all about it.
As we all know, chemotherapy drugs are very expensive, and depending on your insurance, you could have a large copay. On your screen, you will see several different charities that offer some form of financial assistance. I will post links to their websites in the chat window at the end of my presentation. These organizations may help with copays, travel costs, insurance premiums, diagnostic testing, or prescriptions. If you have AL and a blood cancer such as myeloma, lymphoma, or Waldenstrom's, you may be able to qualify for assistance due to your cancer diagnosis if they don't have a fund specific to amyloidosis. Eligibility requirements for many of these programs are dependent not only on your diagnosis, but on your financial status. So be sure to check the eligibility criteria with each different organization. Most require you to have a household income limit that is at or below the 500% threshold set by the U.S. Federal Poverty Guidelines. As you can see from the chart on your screen, the income limit goes up based on the number of people living in your household. Since these organizations are reliant on donations, they must on occasion close their programs to new applicants. But if you have been approved for assistance, you should continue to be covered for the time period or dollar amount of the grant you were initially awarded. To make it easier for you to know when a fund reopens, I suggest that you sign up for the PAN Foundation's new Fund Finder app. It's very quick to sign up, and they will send you an alert via email or text when any amyloidosis-related funds open back up. It eliminates the need for you to constantly check multiple websites for funding updates. If you are uninsured or underinsured, you should also check with the individual drug companies to see if they can offer you any assistance. Lastly, the Leukemia and Lymphoma Society, HealthWell Foundation, and the PAN Foundation are offering $250 to $300 to any patient that has been diagnosed or exposed to COVID-19. On April 15th, NORD, the National Organization for Rare Disorders, implemented its COVID-19 Critical Relief Program, which will provide financial assistance to eligible patients covering up to $1,000 annually. This funding will provide patients with financial assistance that may be utilized to support critical non-medical needs due to the current crisis. Since all of these programs are set up differently, please contact each organization directly to see if you qualify. Their contact info will be posted in the chat box for easy access. I'm now going to change hats and talk to you about the Oneamyloidosis Voice website. In early 2019, the ASG collaborated with Rare Life Solutions to bring the world an excellent source of curated information on amyloidosis. When you go to oneamyloidosisvoice.com, you will see the registration page. You have the option to enter the main site from this page without joining, or to better protect your privacy, you can register and gain access to added features such as the social wall, where you can then chat with other members. The home page is currently shown on your screen, and if you look towards the top right, you will see our newly implemented language selector menu with English, Portuguese, and Spanish as options. Japanese translation will also be added next month. When you move to the left-hand side of the page, you will see several different headings. Click on the Trusted Resources tab, and you will see a host of options. There's a video library, a repository of scientific articles, current news, a list of upcoming events, blogs, links to social media sites, and the list goes on from there. People and Places is a personal favorite of mine because it takes you to a comprehensive listing of physicians, hospitals, and treatment centers. There are 165 physicians listed, and if you click on their name, you will see a more detailed profile. When you click on Places, you will find 75 different hospitals and treatment centers listed. Off to the right of this slide, I have placed a peek view of the detailed listing that you would see when you click on the name of the center or hospital. Diagnosis Educator is the final tab I am showing, and it is where you will find information about diagnosis, treatment, and support. As you have seen, Oneamyloidosis Voice is a great resource for you to utilize, and I hope you take the time to look over the site yourself. Thanks for your attention today, and I look forward to getting back out on the road for our face-to-face support group meetings. Muriel, back to you.
Thank you, Paula. That was great, especially the help with COVID. That's good to know too. And I know some of you doctors might want to have access to some of that information for your patients. And I know Paula typed in a lot of links in the chat window for everyone. But if you need more information, don't hesitate to email Paula or me. Paula is at paula@amyloidosissupport.org, and I am Muriel at amyloidosissupport.org. So you now probably know Bob's email, which is bob@amyloidosissupport.org. We keep it simple. And speaking of Bob, he's our special projects director and director of webinars and any other title we will be giving him in the next month or so. And he's going to give us an update on the registry. So Bob, take it away.
Thank you, Muriel. I'll look forward to what additional titles you have for me coming up. I'm not aware of those. Let me talk to you guys all about the amyloidosis patient registry. I'm going to share my screen to do so. So the amyloidosis patient registry is something that we launched, test launched in October of last year, and we did our full launch earlier this year. The idea behind the registry is to collect data from amyloidosis patients so that we can securely develop a natural history registry and source for people, researchers, academic researchers, any physicians, anyone who needs to access the data to try and determine more about how the various types of amyloidosis are progressing, can access the database and look at this aggregated data about people's natural history or experience with amyloidosis. So the types of things that we'll be collecting through it, you can see here in the graphic. We will be collecting information on symptoms and diagnosis, the various tests and the treatments that you may be receiving, your general health, and I think very importantly, your day-to-day living, your quality of life, how you're surviving with this nasty disease. And we'll also be picking up information about demographics and ancestry because they may provide clues to the development of how this disease affects different groups of people. Certainly it's relevant in terms of ancestry for any that have the hereditary type as well. We can just move. So why are we doing this? Well, first of all, there's no existing registry that tracks the natural history of patients who have amyloidosis. So this is a new initiative here. There's a registry that does collect medical information and has been around for a while, but nothing that actually collects the natural history of people who are going through amyloidosis. We think using it, we can document patterns of disease progression. We can certainly be providing this data for research, and I'll talk a little bit more about how we're doing that in the next slide. We can utilize it to link people to clinical trials relatively easily. We can identify effective self-care, and that's really part of identifying best practices for patients who suffer and for their caregivers so that they have the best lives possible. And we also think it can help in understanding pathways to diagnosis. I think you all saw Dr. Habasi's slide about how long it takes and how many doctors many of us have had to go through to get diagnosed with amyloidosis. The shorter that we can make the path, the sooner we can begin effective treatments. So we are utilizing an organization called the Genetic Alliance that has the platform for engaging everyone responsibly, which is their registry platform. The reason we're doing that is because of the primary focus that they and we want to put on data privacy and security. So already the peer platform is hosting 32 different rare disease registries. They're continuing to make improvements to it, both in the security of it and the capabilities of it. In fact, later this year, we think we'll be able to get electronic health records addended to the data set, which would be a nice improvement to what we're able to collect already. Importantly, each participant, so all of you who are going to sign up for the database or who have already signed up for it, you control who accesses your data. You have complete control of it. Essentially, you own your own data. So when it is aggregated together, it's all anonymized. So no researcher who would have access to the database would be able to figure out who is who. If they wanted to know more specifically or reach out to you, they would have to do so through the ASG. There's a process there where they can reach out, and then you can decide whether or not to share personal information with any of those researchers. But as it stands, there's no way for a researcher to identify personal information about members of the database. And we think that's important because we want to make sure that you're always in control of your own private medical data. And then lastly, our registry managers, they are all certified in protecting human research participants. They have to go through that training in order to manage the database or do anything with the patients in the database. As of this point, we've actually had 400 people already register for it. And this, just to go over this pretty quickly, if you look at the bottom line there in the bar chart, you'll see that AL patients make up over 50% of those who've registered so far. Now, it is, in terms of the other types of amyloidosis, the most common, but yet I think it's pretty significant that most of the people who are listening into this webinar right now have really stirred the growth and supported the growth of the registry so far. So please continue to do so. It's pretty easy to join the registry. You can find it at the Amyloidosis Support webpage. So go to amyloidosissupport.org and you can link to it from the home webpage. There's now in the site menu bar, you can see something that says patient registry there on the left-hand side. Or you can go directly to amyloidosissupport.org/registry. You'll find some information there that tells you about it, and there's also a link to a helpful hints page. But what you would do is click on the Register Now button, and you will go through the registration process. You'll be taken to our Secure Partners site through Peer, and you'll enter in your information about yourself. And then you'll fill out a series of surveys asking you about your history with the disease. There are right now 5 different surveys that you can go through. You don't have to do them all at once. You can do them over a period of time. But all those are collecting very useful and deliberate information that we decided on through a long process and utilized a lot of feedback from physician groups to develop this. So please go in there and take your time filling out the surveys. But do go in there and do register for this. Support is provided by, as you would guess, amyloidosis support groups. And our own Paula Schmitt is in fact our registry manager as well. So she has done a ton of work already in supporting those people who have registered, and she will continue to do so. She is the expert on this, so reach out to her through this address, through the information address here, registry@amyloidosissupport.org, in order to get your questions answered or have any other support from joining or filling out information on the registry. So there you go. I hope all of you who are listening in will stand up and be counted, as Miro likes to say, by joining the patient registry. It just takes a little bit of time, but it's very important in developing a natural history that we all can benefit from. Thank you very much, and I will hand it back to you, Muriel.
Thank you. Thank you so much, Bob. I suspect when we do our next hard launch, probably at the beginning of this next year, we're going to see wild type be twice as many as the AL, but that's, we'll see how that one works. We'll need our cardiologists to cooperate to push their patients on that, but don't do it yet, because Bob has some changes and little thick tweaks he wants to do to the registry first.